Hello, good evening, Assalamu alaikum. I was analyzing the comments of my followers and those who are following my videos, and I realized that most of them are actually either medical students or surgical residents. And when I was analyzing my emails, I found that they want me to talk more about medical education and surgical training than the other topics. So I thought that I'll be talking about other self-grooming topics as well, but I will be now focusing in the form of a series of talks related to clinical evaluation. And this will be a brief video, and this video will be touching the topic of how to take a history. And this will be actually talking to a small aspect of it, but then it will be followed by a series of 10 minutes or 15 minutes videos in which the whole history taking will be discussed. Because normally when I teach it to my undergraduates and postgraduates, it takes about 1 week to really cover the whole topic. So just to have a taste of it, we will start through this video. So the topic is, what is the importance of history taking and how we should conduct it, right? And instead of just adding so many animations and instead of just confusing with the technology, I would like to have an environment of a real one-to-one teacher to student contact. And I'm deliberately talking in English because I realize that many of my students, especially in south part of subcontinent, they asked me not to talk words which they don't understand in Urdu. And since those which are interested in this topic are all medical students or doctors, so I think it will be perfectly all right for them to understand English, right? Okay, see, or let's start from the beginning. This is Ramsha, can you see it? This is Usman, and this is Ramsha, right? I don't want that girls should be singled out from it. And this is a patient. When a patient comes to a doctor, he or she is suffering from all possible diseases which has ever occurred to a human being, or which will ever occur to a human being, and which will be millions of diseases. And out of all these diseases, doctor has to pick the one which patient is suffering from. And this whole process is actually clinical evaluation. Now, how we do it? We do it by following a process. And this is that process. When we have a first encounter, the first thing you do is you take history. And history is what? What a patient knows about his or her disease is called history. The information which you get from the patient is called history. Once you have done with the history, you are ended up, in my opinion, you are ended up with 4 possible conclusions. One conclusion may be that you know the diagnosis. I can give you an example. There is a 25 years old gentleman. He is a porter at a railway station. While he was lifting a heavy weight, he realized that there is lump in his groin, and when he lie down, the lump disappeared. And when he used to cough, the lump becomes apparent. So this may be the history. Now, in this case, you actually know the diagnosis, right? So this is possible. Or it is possible that you know 3, 4, 5 possibilities, which is called differential diagnosis. For example, there is a patient, is a 40 years old lady. She is a married lady, mother of 2 kids. She presented with pain on right side of the abdomen. This pain is dull in character. At times it is associated with food intake. At times it is even without food intake, and it stays for a couple of days and then it disappears. And it is in the midline and on the side. Now this patient may have acid peptic disease. This may have a gallbladder problem. This may have a problem related to liver, right? Now, instead of, you cannot pinpoint the diagnosis. Like in first case, you have 3, 4, 5 possibilities. Now, there can be a third situation after completing the history that you don't know the diagnosis and you don't have 3, 4, 5 differential diagnosis. the only thing you know is the system to which that disease belongs. For example, patient has got pain in the abdomen. And this pain is also associated at times with loose motions. And patient is having loss of appetite as well. And there is mild tenderness over here. Now, what is the diagnosis? Can you say one diagnosis? Can you say 3, 2, 4, 5 out of which you can choose? Perhaps not. But you are sure that this is something wrong with gastrointestinal tract. So you may know the system. And there's a fourth possibility. You are in none of these boxes. You don't know the diagnosis, you don't know the differential diagnosis, and you don't know even the system. For example, a patient has a weight loss. That's it. Serially losing the weight. There's no other symptom. Now in that case, where are you? So all four are right if you have completed the process technically correctly. Right? No, these four are the possibilities after the history. After history, you go for the next step, and then next step is journal physical examination, in which you examine the patient from head to toe. Not specifically a system, but you examine the patient from head and toe. And there is a method for it. And there is an algorithm for it. There's a technique for it. And when someone asks me what is journal physical examination, I just tell them journal physical examination, apart from few technical things, are the findings which even a layman can see. For example, someone is coming who's very fat. Do you need to be a doctor to find it out that it's a very fat man? No. If someone has dark yellow eyes, do you need to be a doctor to know that? No. So general physical examination, apart from pulse, blood pressure, temperature, which are technically needed, you need it, you have to be a technologist to really know that. Apart from that, all the things which apparently is possible, although you name them technically. For example, someone has got a blue tongue and you say central cyanosis, but even a layman can see that it's blue. So general physical examination is nothing but whatever a layman can see, but seeing it through a medical eyes is called general physical examination. And once you finish general physical examination, you again reanalyze in your mind that either do you know the diagnosis now, or you have a differential diagnosis, and at the end of the history, if differential diagnoses were 7, have you narrowed it down now to 3 to 4? Or do you know the system, or still you don't know that? It is quite possible that even after that you are nowhere. But if you are following the process correctly, you are on the right track. After general physical examination, then you do the local exam. We surgeons prefer to do the local examination first. Maybe our physician colleagues would say that you have to do systemic examination. Local means, for example, the disease was pertaining to breast. Now the examination of breast will be called local. For example, it was bleeding per rectum, then rectal examination will be called local examination, and so on and so forth. After that, then you do a systemic examination, which means examination of central nervous system, examination of cardiovascular system, examination of respiratory system, examination of gastrointestinal system, of the locomotor system. You do a thorough systemic examination, right? And after systemic examination, now you again find it out that where do you stand? And most of the time, you have got one direction, and I call it working diagnosis, on which you have to work now. This is the possibility. This is the area we have to work it out. And in order to confirm it, now you go on to investigations. And when we were studying, it was taught towards routine investigation and then specific investigation. I don't think that this is the correct demarcation. There is no such thing as routine investigation. Every investigation has to have a purpose. If you want to get blood complete examination, there has to be a purpose. If you want to do a urine examination, there has to be a purpose. So blood complete examination, urine examination as a routine, I don't buy this idea. So you do an investigation, and purpose of investigation is not to find out what is wrong with the patient, but purpose of investigation is that whatever my suspicion is, I want to confirm it or rule it out. So when you finish with those investigations, and there is a series of investigations, going up to radiology and histopathology and invasive investigations and chemical assessments or hormone assessments, and once you finish that, then you reach at a diagnosis, right? This is the whole algorithm. Unfortunately, incidentally, with the advent of technology, I have seen so many TED videos where very senior teachers have said that a patient gets his CT scan, a Doppler scans, before actually he shakes hands with his treating clinician. Before actually he meets his treating physician, he has all the investigations done. Now, the technology is very important, but there is no shortcut to this very simple basic thing which starts from history taking and reaching up to investigation. And I always tell my students that teaching at a diagnosis is a step-like process. First step, second step, third step, fourth step, fifth step. Can you take a first step and then take a seventh step? No. If you do that, you will break your leg. In this case, breaking leg means life of a human being. It's the life of human being as well. So in subsequent videos, this is just the kind of list of the things which you're going to study. So for next maybe 15 days or month, I'll not make videos on other topics unless and until some pressing reason for that. After every couple of days, I will just take these points one by one. We will in detail talk about history, because history is not one segment, and we will be just focusing what is past history, what is family history, what is personal history, what is the importance of it. Yeah. And then we will go for general physics exemption and we'll spend a full video on that. So I would be waiting for your feedback for that. Let's see whether it works well. And if you have not yet subscribed this channel, the name of the channel is Knowledge from Knowledge to Knowing, and you have to type Surgeon Javed 1 as a single word, and you will subscribe it. And I always say that we are here on this planet for a very short period of time, So quantity wise, it is nothing. It's nothing. But even one moment can be so much immense quality that it can influence thousands of people. So let's actually utilize this time to spread love, to spread care, and to spread knowledge. Thank you for watching.